I used to say in agriculture there was a renaissance of the past taking place, that we had new people doing old things with new technologies, a rebirth of agriculture taking place in Vermont. Because farm families in the past lived on local food. I grew up on local food. You had to work in the field, you had to work weeding the garden, and likewise we have a renaissance of the past taking place in healthcare.
We're shifting from trying to chase medical problems and take care of them as they come up. And primary prevention would be, let's live really healthy lives and see if we can never develop the disease at all.
The Vermont Work Group was formed, I think, in 2008, so we've been working together for many years. The group comes together to learn and strategize about local foods, healthy foods.
We're leveraging the big distributors. We're working with them. They're bringing in additional products every year. And what we're working on is bringing locally sourced foods to hospitals.
Food service directors, food service managers, chefs, sharing their experiences, their challenges, and how to overcome those challenges.
For us as a group, we've had issues over the years with buying certain products, and one of the products in Vermont is chicken. We were able to say that to our purveyors that we needed that. By having that conversation, we were able to bring in a sustainable chicken for all the facilities.
If you're just, one hospital and you're not getting heard by your distributor, but then, 10 hospitals come to this distributor, and with that message, it's more impactful.
I think the positive impact for the residents is that we're finding they don't go to the hospital very much. We find that their health is much better. I can tell you that they're happier to know that they're working with local farms, that we're buying local produce. And that alone really is the best thing I can do for my residents.
Great patient satisfaction, really great quality health care with decreased costs. And in order to do that, we really need to promote healthy, well-being, wellness behaviors.
It's important to, take care of people while they're in the hospital, but also give them the education and the knowledge to how to take care of themselves when they leave.
And they have some recipes. What I think is unique about healthcare shares is that you're tying good nutrition, local food, and healthcare together.
The healthcare share is a partnership where medical centers identify patients who are food insecure or who have diet-related illnesses. And we go to work on our end, putting kids to work, paid employment, growing food, weeding that food, harvesting that food, packing that food, and delivering it to patients at their local healthcare providers' offices.
It allows care providers, physicians, and others to actually have something to offer when a patient says they're food insecure.
It's expensive to go into the store and buy all sorts of vegetables, things that I know that my children need. This gives me the opportunity to get those vegetables, try new vegetables, things that we would never even think of trying.
We need to be teaching folks about good nutrition. We need to be teaching folks how to cook who don't know how to cook, and decreasing the barriers to a healthy lifestyle.
I want to be healthy. I love eating fresh food. When we were living in Nepal, we used to eat so many fresh vegetables, everything. And then once we came here, season is totally different. You can't grow anything in winter time. And then when I heard about fresh food, I'm like, yay, I want to have it.
The kids and families that are participating can go home, maybe even cook together and have a family dinner together. So it has impact that's greater than just healthy eating. Social impact as well, family connection impact.
The local food system is really supporting the health of Vermonters, and the healthcare system is actually also supporting in turn the vibrancy of our food system and the production that's happening in the state.
That was our very first sales meeting. It led to an order, and it was a very important part of us getting going and getting established.
Now, I think everybody, thinks it's a boutique thing, small organic farms and stuff like that.
Having access to farmers markets and directly buying food from farmers is really important. But it's also important, if we're going to scale up this food system, that we use wholesale market channels.
Because of the volume we do, we actually have a different price strata for for hospitals and institutions. You know, we're like lettuce where we have a lot of it. For us to sell, you know, a few cases at $4 or $5 less than what we can sell organically, that doesn't hurt us.
If you're buying wholesale and you're buying a large quantity, the farmers are looking forward to working with facilities like Wake Robin or other institutions because they know the clientele is going to be there. They know the amount of food they have to grow, and they know that we're not going anywhere.
Vermont's a pretty small place, and we can do things collectively much easier than we can in other states.
Every time you buy locally with a local farmer, those farmers are also buying locally. And so again, you think about that ripple effect, and it's huge.
It builds teamwork, it builds excitement, it builds direction, and it brings people together.
I think just getting together, sharing your stories, what you're purchasing, who you purchased from, what was your challenge, you know, how did you overcome it? Maybe you don't know how to overcome it, and just working with the group.
The value in that is just enormous, and there's no reason why all of us should be in our own institutions working by ourselves when we can learn from others.
Food is medicine. It's nourishing, it takes care of you. If you don't eat right, you're not going to feel right. If you eat good, you're going to be healthier.
As institutions, we need to make a difference. And so when I think about healthy food and the work that hospitals are doing across the state, they are role modeling for their communities, as well as having a huge economic impact on the farming communities. And I think if we want to have big change, it ripples out from those institutions.